when you have a skin that's cracking deep, very often the body is a little too alkaline, and they respond beautifully to cal-ammo.
My main complaint is that I have this noise in my head all the time. It's not really a ringing. It's more like hearing the next door neighbor's shower going all the time.
Ah, okay.
Noise, and I have a stiff, painful neck for about 2 weeks. The noise has been for about 5 months. And then I have a squeezing right here sensation occasionally.
Okay.
That scares me.
So she's got 3 symptoms that are going. She has a noise that seems to be occurring in her head. She's got a stiff neck for a few weeks, and she gets some tightness over her chest,
Right
like
here.
a feeling of squeezing in her chest. So let me have you lie down, and let's see what the body tells us about this. Okay, so that's nice and strong. Belly button. Regulation's nice and open. Okay, hold that strong. Good. The other one. Okay, so you're not testing as being switched. Regulation is open. This is very good. This is a good ratio that we're getting. It's pretty consistent with a functional illness practice. So I want you to put your hand right on that spot that you get the tightness on. And goes crash. See that? No strength at all on that spot. So that's one spot. I'm going to check your neck, and that also is weak. And where do you get the noise?
On this side.
You feel like it's in your head?
Like up here, yeah.
Yep.
It's more than right here, and it's not a loud ringing. It's like a shushing sound.
Okay, so bring this up like this. Good. I just want to check in this area. Strong, strong. When I go into the ear canal itself, we get weakness. So there's something going on here. So let's see what else shows up, and then we'll prioritize and see where we're going to start, right? Okay, what is this? Oh, it's just a little necklace? Okay. Okay, and we're just going down the body. We got that one spot there that tested. We don't quite know what that is. Interestingly, the only things that are testing are the actual areas that she has symptoms in. So what we're going to do is prioritize these out and see what we find. And I'm going to go right to the ear first, and that's strong as a rock, so that's not a priority. We're going to go to the neck, and that's strong as a rock. Now put your hand right on that spot. Good. And it goes weak. So now we got an interesting thing. Let me see what we're feeling here. We're right on.
That's it.
We're right on the bone.
It hurts. It hurts when you press the bone, but when I feel the squeezing, it's like right there.
It's right in here.
It's like this sort of a squeeze. Ow.
Okay. So what I want to find out, I want you to keep your hand there so I can test this, because it's kind of a hard to find spot. And I just want to see if is there a food allergy connected to this? Doesn't change anything. Is there an immune? Nope. That's metals. That's chemicals. Not a scar either. Okay. So now we're looking at what are the possibilities that we have here. One is I would look at magnesium. I look at cataplex E2. I'm going to look at cataplex G just to eliminate a cardiovascular reflex pattern, right? And we'll see what happens on that. So here's some, keep your hand on that spot, which is weak, yes? Magnesium. See that? So she's getting, see how strong that is?
Mm-hmm.
You take that off and put it back into that mode. What do you have? Okay, let me have some Cardio Plus as well. And, wow. Cataplex E2. Go ahead. What she's testing for is actually a reflex from the heart. We got a viscerosomatic reflex here, and she's getting some spasms in the heart muscle, which is reflecting itself in the muscles. The little muscles are on the ribs, between the ribs. Kind of interesting, because she really responds very well to this. See how strong that is? That is really strong. Now, take that away, and we'll check your neck. Remember how weak the neck was before? See that? And we'll check this. That is like a rock.
Difference.
So what we're getting is the sound that she described was a shushing sound. It's like a blood pressure sound. Has anybody checked your blood pressure?
Yeah, it was okay.
And it was okay. Can I just check your blood pressure reflex? There's an area on the front of the biceps that you can sometimes use to get a blood pressure response. So relax this here. Just want to find the front of the biceps. Okay. And just match my pressure. And it just goes crash. Crash. Look at that. I'm going to put this on here. Ready? See that? So there's some kind of pressure situation, and basically what your body is asking for is to give you more parasympathetic support to relax the heart and the circulatory system. So this is functional illness, folks. This is not disease. But what happens to functional illness if it stays there long enough? It develops into disease. So this is something very typically where a medical doctor would say, well, we could do an MRI, or we could just wait a while and see what develops. Yeah, because right now it's not nameable. But what we have is some sort of cardiac stress. It's good. We'll fix it. We'll check you for enzymes. And that's strong. Check you for any allergies to this. That's strong. And make sure that regulation stays open. Does. Beautifully. Good. So now we're going to dose it. So let me have this hand in a cup position. And we're going to start with 6 Cardio Plus. And see how strong your body is. It is strong, so let's go to 9. Too much. 7. 6 is perfect. So 6 Cardio Plus. It's going to relax. You're going to find that you're going to be sleeping better too, by the way.
Because I'm not.
See, she doesn't sleep well either. And people whose hearts need parasympathetic support don't sleep well because their hearts are still racing and running and working even after they're supposed to be relaxing. So I'm going to check you for magnesium. How's your bowel function, by the way?
Constipated.
You're constipated. Is this interesting? I mean, it's like somebody who just sat through my last lecture and I just described her without knowing that that's what I was going to see here. She's got some early cardiovascular symptoms. She's got early pre-blood pressure situation going on, and she's constipated. So we'll test her for some magnesium, and let's see what happens with 2 is very strong. Go to 3, very strong. 3 is good enough, and that should loosen things up. You can, by the way, on yourself, take 3 magnesium a day, and if your bowels aren't loosening up, gradually increase it a little bit, get your bowels moving. And if they get too loose, back it back down to 3, right? Because that'll take a lot of stress off your heart by getting this the muscle activity going properly, right? Get the spasm out of there. Okay. And Cataplex E2, we're already giving you Cardio Plus, which has Cataplex E2 in it, but your body's kind of asking for a little extra to relax blood vessels. So let's see how much extra is really the question. Boy, that's good. 6 extra. So I'd say 6 Cataplex E2. That would be the program that I'd put you on, and I have utter confidence that you're going to start getting better within a few weeks. But you must stay on a program like this for a minimum of 3 or 4 months.
Okay.
Right? Good.
Do it.
Yeah,
Thank
you're going
you.
to do better. You're going to do quite good.
Thank you.
Okay.
Appreciate it.
Yeah. It's good, huh?